Hello everyone, my name is Dr. Ann Dabra-Woods and I'm the Chief Nurse of Wolters Kluwer Health Learning Research and Practice. And today we're bringing you part of our series from the desk of the Chief Nurse. And today we're talking about the Nurses Week theme, Healthy Nurses, Mind, Body, and Spirit. And joining me here today is Lisa Bonzel. She's a nurse practitioner. She's also our Senior Clinical Editor for Lippincott Nursing Center. So thank you for joining me today.
Thank you for having me. Hello everybody.
So the American Nurses Association set the theme to be Healthy Nurses, Mind, Body, and Spirit. And I thought it was a very interesting theme. I think that you probably agree to me. Why would we do that? Why would the ANA set that? But I think, as you and I have talked many times about, if we're not okay with ourselves as nurses from a biopsychosocial place, we're not going to be good at caring for our patients. And so many times we really struggle with taking care of ourselves because we're so busy taking care of others. How do you feel about that? I
agree. I mean, that's what we were trained to do, and that's, kind of ingrained in us, is take care of everybody else, make sure they are practicing, healthy behaviors, and we teach it every day, but a lot of times we don't take our own advice.
I'm sure you and I both remember back in the day when you'd have a healthcare provider come into a patient's room. You'd just been in there trying to teach them to stop smoking, and another healthcare provider comes in and they smell like smoke. Now that was certainly not, empowering our patients to make good decisions, because we as healthcare providers weren't making good decisions at that time. And I think that we've really tried to get away from that, and I think we've been pretty successful with that. But what do you see, Lisa, as some of the issues about why this is so important for us, and what are the things that get in our way?
I think everybody is very busy. Everybody is very busy. Nobody has time to manage their own health care. Nurses especially, we struggle to make the time for ourselves. So, better time management is a big one. And prioritizing what we need to get done, because so often we're putting other people first, and we can't take good care of other people if we're down. So we really need to make that a primary focus. And it's not just on healthy eating and on exercising. Like, a lot of times when we make a decision to get healthier, those are the things we focus on. But what about our spiritual needs? What about our mind? There are a lot of components to this. Stress management. I mean, we're in high stress environments every day. So, how do we get past some of those days and, kind of debrief?
I know one of the biggest issues for me until recently was the ability to say no. As healthcare professionals, nurses, we always want to say yes. Yes, I can do that. I can take that one more patient. I can do this. I can go take care of, the situation in my family, my work environment, my school environment. Learning to say no for me was really critical to helping me be a healthier person. So I know that you have done some great work on Nursing Center to support the Healthy Nurse Initiative for this year. And I know you developed care plans for nurses, which is a phenomenal idea. We're so busy making care plans for other people, but you've actually said, let's stop and develop them for nurses. So could you tell us a little bit about that and some of the other things you've done on Nursing Center?
Sure. So my nursing care plan, as you said, Anne, is really a care plan for us as nurses. So there are 3 components. One, focusing on our professional requirements. So that's kind of like the have to do things. Lifelong learning, which is what we really all should be doing. And then work-life balance, which, without that, we don't have anything. So we really need to get organized. So if you use these care plans and these components to organize, okay, this, I need to renew my license this year, and I need, 30 more contact hours and to be able to do that. So if you kind of follow these guides and write it down and put it on your calendar at the beginning of the year, or, whenever you get the time to do it, you'll feel better organized. And I know when I'm more organized, I sleep better. I have more energy to do the things that are important to me. I, just manage my time better because I'm better rested and organized. How about you?
Well, I actually used your care plans because my licenses were all coming due at the same time, and they really, really helped me this year, your care plan, to really stay on the track for what I needed to get done and really refuel my passion of what I feel for this profession. I think sometimes we get so busy doing so many things for somebody else, for other people, that we forget about the passion that really brought us here to this profession. And it's not till we take care of ourselves, our mind, body, and spirit, that we're really able to recognize that passion and to really put it into our practice. So thank you, Lisa, for joining me today to talk about our initiatives and what we're doing to support the ANA Healthy Nurses, Mind, Body, and Spirit.